Welcome to the Let's Talk Health and Care podcast series brought to you by the Integrated Care Academy at UWE Bristol. We'll be diving deep into exciting research and service changes by speaking to the people directly behind them. I'm Peter Brindle. I'm a GP with a real passion for service improvement, health tech and innovation.
And I'm Mark Griffiths, Pro Vice Chancellor and sponsor for the Integrated Care Academy at UWE Bristol. Welcome to Let's Talk Health and Care.
In a world racing to solve tomorrow's most pressing challenges, One Bristol Innovation Centre has quietly become the gold standard for university and industry collaboration. Future Space at UWE Bristol is a multi-award-winning innovation centre designed for pioneering high-tech, high-growth businesses solving tomorrow's biggest challenges. Welcome to Let's Talk Health and Care, where we explore the cutting edge of health innovation.
What makes Future Space truly special isn't just impressive growth statistics. It's how it's redefining the bridge between academic research and real-world innovation. Today, we begin with Professor Matt Freeman about leading what many consider the benchmark for university-partnered innovation centres across England.
And then we'll be hearing directly from two health tech companies that call Future Space home, giving us both the strategic vision and the frontline reality of being a health tech founder and how innovation can really transform healthcare. Welcome, Matt. It's great to have you on the podcast.
Honestly, thank you ever so much for having me, both of you. It's kind of great to be able to talk about Future Space and what we're all about, and hopefully share some kind of useful stats and insights with your listeners. So thanks for having me.
Brilliant.
Matt, first of all, tell us a bit about Future Space. What is it, and how does it fit with other elements of the enterprise zone at UWE Bristol? What does it aim to achieve?
Yeah, sure. So Future Space is just coming up to its 9th year, actually. So, I mean, we describe ourselves as we are the university's enterprise innovation centre, essentially. So we're based right in the heart of the enterprise zone. So the kind of origins really were around sort of 10 years ago. UWE was kind of part of a big kind of government grant that was part of a much wider national experiment, really, I think it was at the time, to see what happens if you put businesses right in the heart of a university campus. What happens in terms of collaboration, in terms of innovation, in terms of creating jobs, in terms of opening up opportunities for students and academics? Does that proximity create any kind of added value that maybe a partnership doesn't, for example? And UWE was one of 5 universities, I believe, to secure the funding to establish the enterprise zone, and then Future Spaces. So we're a space for businesses to reside. So we have a mix of office spaces, lab spaces, technical workshop spaces, and we've got around 70 businesses at the moment, all of kind of varying sizes, everything from, a one-man band all the way up to 20, 30 people, kind of scaling up, and everything in between, really. And really, I mean, what we're about attracting what we hope are the most sort of innovative, high-tech, high-growth companies in the region. So we're not just a house or a home or a landlord for any old business. We are really kind of a growth base for some of the most exciting R&D-led, innovation-active, high-tech businesses across the region. Companies that are really trying to genuinely innovate and create something incredibly kind of new and exciting and dynamic, that are all kind of, trying to solve some of the world's biggest challenges in their own way, really. And the value, as we see it, in terms of being not just based on a university campus, but part of the university, is that the university is the mechanism for how that growth occurs. So we say to our businesses, our message is, look, come and base your business here, and you're not just going to get 4 walls. What you're going to get is you're going to get 4 walls, and then you're going to get the best students in the region. You're going to get the best facilities in the region. You're going to get some of the brightest academic minds in the region, all solving some of your problems together. And then through doing that, we're not only hopefully kind of working towards the university's enterprise agenda, at the same time, we're helping to create jobs, develop products, get those products to market, and reach a point where you can scale and ultimately no longer need a place like Future Space.
Just before Peter comes in with his kind of next question, there's something also about showing students on all levels of study what the art of possible is in the innovation and enterprise space, Matt, as well, isn't there?
There is, absolutely. I think that, my background's in academics, so I spent many years kind of sort of lecturing, and it is that sense of almost trying to sort of explain to students actually what are the opportunities, and actually particularly when you're doing something that's quite innovative and experimental, and you're creating, a high-tech thing that maybe doesn't even exist yet, or certainly hasn't kind of come to market, actually trying to demonstrate to students that actually in many ways the jobs with those companies are far more enriching, far more exciting, far more prosperous actually, than saying I want to aim to work at an enormous corporation where actually you'll be quite faceless, buried within the crowd. And actually the opportunities to grow and develop will probably, not to generalize, but probably be far less fruitful than working at a startup like at FutureSpace that are really at the cutting edge, really experimenting, really allowing their students and their graduates to get stuck in, to bring in their own ideas, to apply their knowledge and really make a difference, I think, as well.
So a recent report shows that FutureSpace at UWE Bristol is one of the best enterprise zones around. Is it really this combination of the academia and the industry that is the essence to that and differentiates it from perhaps the more traditional incubator?
Yeah, I mean that report was quite illuminating actually when I read it, and I think what it sort of picks out is the fact that experiment that I alluded to in terms of let's bring businesses onto a university campus and call it an enterprise zone and see what happens. I think what that report kind of alludes to is that all of those different university experiments have all been successful, but in very different ways, which is interesting because even though they've all been given similar pots of money and the remit was very similar in terms of bringing businesses and academia together, actually they all went about it in different ways. They're all managed in different ways, owned in different ways, funded in different ways, had slightly different objectives. And as a result, the success was kind of varied, but successful in different ways. So for example, in the report, kind of talked about how some of those spaces became actually quite detached from the university, ironically, even though they're based on the campus. They actually became quite detached, very successful as an isolated space in and of itself where businesses were based, but actually quite detached, not just from the university, but from the wider ecosystem as well. And actually, in a weird way, putting the business on a campus, in some instances, it seems to suggest it cut off that ecosystem engagement, interestingly. And then there's others where actually it's heavily embedded into the university, but perhaps at the expense of that kind of wider sort of ecosystem kind of engagement. And I think when FutureSpace kind of comes up and UWE comes up, what it seems to point to quite a lot is that consistently across the 9 years, what we've tried to do is make sure that both of those worlds are joined up. It's not always easy to do, and it's very difficult to do. But that central mission, which I know has always been sort of driven by UWE, is this is a space that brings together both sides for equal benefit, and we need to be measuring both sides equally. Student jobs, great, but also products coming into market equally. How do those things work together? Is consistently highlighted as a strength of what we're about.
It's quite a big cultural difference between those two communities.
It is massive. Yeah, absolutely massive. I think again a lot of it kind of comes down to vision. I mean, something that UWE has been very, very focused on is consistently ensuring that there is complete alignment in terms of its research beacons and the gateway sectors that are at FutureSpace. And there's a language difference, there is a cultural difference, and we do a lot of translation between the two worlds. And we go, okay, well, UWE's research beacons are X, and that is great from a research perspective, but it might not always translate into a business sector, for example. So what's that kind of translation piece we need to do? And then equally, what's the opportunity to dig into kind of possible subsectors that may be sort of part of that research beacons that might not necessarily be apparent, but are really kind of emerging in terms of sort of commercial opportunities and align in those ways.
So FutureSpace sits at the heart of UWE Bristol's RISE agenda, which is the research, innovation, skills and enterprise. Matt, how do you ensure the commercial success of your resident companies aligns with the university's broader academic and research ambitions?
That may as well be my job description. I think it was the reason why I was brought in, is being able to sort of try and think about those two very, very different worlds, very, very different cultures that should align but don't always. And how do we kind of sort of make them kind of work together? I think what we've done a lot of experimenting, and I've been quite grateful that I've been given the the freedom to experiment and to try different things out, some of which have worked better than others, and then we've kind of iterated, and we've done a huge amount of work, to be honest. Everything from our messaging on our website to our product services to the way that we report has all kind of undergone a fairly extensive transformation really over the past kind of couple of years. But I think what we've ended up with is this kind of two-pronged model where we go, okay, so we need to be driving the university's enterprise agenda. That's fine. So that's knowledge exchange stuff, that's graduate outcomes, that's income, that's stuff fine. But then equally, we need to be driving what the company's needs, which is around new products and new jobs and investments and these sorts of things. And no matter how you square it, they're different. They are different things with different agendas and different KPIs, and you cannot get away from that. So I think what has previously kind of been the case is that, sometimes innovation centres might just try and maybe just ignore some of the other bits and go, we're here to support the business. But by the way, there is this sort of university agenda behind the scenes, or flip it around the other way. What I've tried to do is go, what, let's just put all of that on the website. Let's say, in plain English, that's what we are. We're a university partnered innovation centre, and we've got these two missions. The way that I think we've got it working is by going, okay, we may have two different missions that go in different directions, but actually, if we can create a set of products that sit in the middle, that drive both of those two missions simultaneously, everybody wins and everybody's happy and everybody's on the same page and everybody's got a clear sense of their expectations. So what we've done is we've gone, okay, what are the big products that sit in the middle that both of those two worlds want simultaneously? Things like R&D is one. So we've brought in research and development as a core activity that Future Space now delivers, because R&D is academic research, but it's also product development. It is the same thing, it's just done in slightly different ways. So we've then brought in a whole bunch of R&D products where we've packaged them up and go, okay, well, what does an intern look like as an R&D offering? What does a student project look like as an R&D offering? What does a facilities access thing look like as an R&D offering? How much does it cost? What the time does the academic need? What time does the student need, etc.? What are the IP considerations? What are the insurance considerations? What the budget? All of these kind of things, mapping it out as a product. So then when we bring both sides together, there's a very, very clear expectation from both sides about what's required. And everyone knows why the other side is there as well. There's no kind of illusion around it. We're not hiding anything. The student's there to get experience and get a job. The business is there, hopefully, to develop a product that goes to market. And an academic is there, hopefully, to make their research slightly more impactful. Everybody knows that by being on the same page. But we're doing it in the same way because we've designed a product that has been thought about from all of those different agendas. So then all we have to do as a centre is we report it in two different ways, which is fine. So we look at what happened, we evaluate the impact and what happened as a result, and then we go, okay, how many students were involved? What was their evaluation? What was their impact? What experience did they get? And we report that. And then equally for the business, how did that support their product? Did they gain any new customers? Did they secure any investment off the back of it, for example? And then we report on that. So we still report in two different ways, but the activity at the heart of it is singular. And we've tried to do that with everything. So the products, we do that. The services, we do that. Even our messaging on our website and our social media now does that. It's a university partner innovation centre. We are driving both of these two worlds simultaneously. But what we try and get across, where we can through case studies, etc., is that we are doing this, we hope, as well as, if not better than anybody.
So you're very explicit upfront about the twin missions.
Exactly. Exactly.
And given that Future Space focuses on health tech, green tech, digital and advanced engineering, what role do you think the university industry partnerships have in addressing the future health and care challenges that Britain and the world faces?
Yeah, I mean, I think, obviously you've got a couple of incredible entrepreneurs coming on shortly after me. You can answer that question I think far more richly than I can. But they are great examples, in terms of creating smart socks for dementia patients, and we've got businesses, coming up with all sorts of new diagnostics kind of testings and all sorts of things. And in some ways, I think the answer to that question is similar to all of the sectors that we work with, whether it's of engineering or green or sustainability type technologies. It is that idea that all of our businesses are trying to change the world, and also what I think we're quite proud of, it's not necessarily something that we've kind of designed, but it's something that has kind of become part of our brand, is that we're very much about real world innovation. There's lots of sort of, like other incubators that focus on different types of tech. Slightly more deep tech is kind of, quite common at the moment. It's not that we don't do that. It's just that a lot, if not most of our businesses are hardware. They're creating a physical thing as opposed to a piece of software. And that physical thing goes out into the world and has a real world value. It's for real people with a real need that you can explain in a single sentence. And everybody gets it. And that's not always the case with high-tech companies. Being able to just go, okay, it's for dementia patients. Great. It's really, really clear, really, really straightforward. And I think what that means is that it makes our lives a little bit easier when it goes to, let's attract students to work on that project. For whatever reason, I don't know what it is, but culturally, I think students now are really, really driven and motivated when it comes to things like the environment and healthcare and social justice and all of these sorts of things. So when they see a company that, like those we have at Future Space, that are actively focused on that rather than the so-called commercial world, which for whatever reason tends to be putting off quite a lot of young people at the moment, it's very, very attractive. It's very, very appealing, and it's something that they kind of want to get involved in. And then that just creates so many opportunities, whether it's students doing early stage research or some of that research that maybe the business hasn't got time to think about. More commonly, what it is, it's testing. To be honest, it's those businesses that have got that MVP, they've got that product, and in order to secure investment, what they really need is to be able to test it, to evaluate it, and then be able to demonstrate to investor, look, we've done testing on 100 patients, 200 patients, 70% of them, this was the result, in order to sort of validate that particular prototype for the next level. And that, I think, is what we're finding that the university is just so valuable for, either because students are doing that research, academics are feeding in insight, or they can literally go and make use of facilities to test and to validate.
Interesting hearing about it being sort of values driven, that people are motivated to work in this area mainly or partly at least because of their values, helping people, helping the environment, whatever, which is great. It's lovely to be associated with that.
So Matt, you've witnessed Future Space evolve significantly over the recent years. What surprised you the most about working in this space, and what challenges have you encountered that outsiders may not anticipate or appreciate even as well, working in a space as you described?
I often describe Future Space as kind of like a house of cards, but in the best way. Like I'm very motivated in terms of challenges and experimentation, and sometimes things work and sometimes things don't. I don't think it comes across this way to our businesses, which is a good thing. But I think behind the scenes, there's very much lots of, well, we need to sort of think about how we're going to make this work. So there's, for me, what's been really, really challenging is, and I think this is not UWE, this is all universities, this is higher education. We're figuring this out in terms of how to really do this entrepreneurial thing, whether it's on campus or not. We're all still figuring this out, and as the sector's getting better and better and better at it, and we're trying to figure out how to make it work for all parties at all times, at different stages, at different scales. And that does involve trial and error. And for me, then the challenge is when you're then dealing with a commercial business who is a customer as well, and if it doesn't work as well, and they haven't had that particular outcome that they perhaps wanted, being able to sort of communicate that in a way that actually, you know what, we are figuring this out and we'll learn from this. We'll make this work in a different way.
We've touched on one particular challenge, but looking ahead, because I guess you want to scale this model. It seems very successful, what you've been saying. So you're aiming to scale it. How do you maintain that really delicate balance of fostering innovation while also supporting sustainable business growth from your resident companies? I guess there's potentially a bit of a tension between the two.
Yeah, absolutely. I mean, there's a few things that we're doing, and then a few kind of bigger things that we're starting to think about. We're really trying to embed Future Space into the wider sort of enterprise remit of the university. So we're next door to Launch Space, which is the incubator, which is for slightly earlier stage businesses. We've always had a kind of a good relationship there, but we're really trying to formalize that. Same thing with kind of student ventures and that sort of even earlier stage sort of business enterprise stuff. Is rather than just have 3 pillars of enterprise support that happen to be on the campus. How do we join those things up? How do we combine the teams together and share resources and think about, co-delivering of workshops or sessions? How do we make more students aware that actually this is just a route that they can go down anyway, whether it's to set up their own business or to get a job within a startup, for example, and really start to join all of that up. Bigger picture, though, I think what's kind of going on at the moment, and it's no surprise to anybody, is our model, like a lot of all innovation centres really, is predicated on that idea of space. That idea of you rent a space, you have an office or you have a lab, and of course post COVID, that's increasingly changing. So it shouldn't really, I think, be coming as that much of a shock that more startup businesses, even though in certain sectors like health, for example, they might need a lab more than other businesses might need an office, arguably. What we're starting to see is there's much more demand for kind of hybrid working. Yeah. And the idea that actually you don't need to be in an office all the time. So right now, all of our smaller spaces, all of our shared lab spaces, for example, are completely full. We've got waiting lists, massive demand there. And it's the bigger spaces that are actually slightly vacant at the moment. And it really does reflect that. It's we've got big companies that are part of FutureSpace, but they don't need a 20-person lab because they need a 4-person office, because it's 4 people that actually see the value of FutureSpace as being about R&D and university collaboration, and only 4 people within the team do that. So they only need an office for 4 people, and actually everyone else is based somewhere else. So we've brought in a virtual membership option, for example, this year, which is for those businesses that may not need an office at all, but they need a growth base, they need R&D, they need students, they need talent, they need investment, they need all of that sort of stuff that we can, we can start to work with. How do we then start to move beyond that idea of Monday to Friday physical space and start to think a little bit more hybrid, a little bit more post-COVID about what a post-COVID innovation centre might actually look like?
And actually, many of those themes follow where the universities is also trying to look at how space is utilised, the approaches. So there's such synergies there with how I think the HE sector is having to adapt as well. So yeah, fair shout there. Thank you for that fascinating insight into FutureSpace and how it's shaping the future of how we solve healthcare challenges and beyond. Really, really kind of insightful gaze there into what FutureSpace is about and how you're translating that into everyday enterprise and innovation.
Thank you very much.
And coming up, we'll meet 2 companies doing exactly that, turning cutting-edge research into real-world health solutions right here in Bristol. Our first entrepreneur is Dr. Jenny Bailey-Cooper, the co-founder of Ferryx, a university spin-out company developing innovative gut health solutions. Now, as many of you know, irritable bowel syndrome, or IBS, is an incredibly common condition affecting up to 1 in 5 people in the UK. And the impact on individuals can be very debilitating, from chronic pain and discomfort to disruptions in work, social activities, and overall quality of life. But Jenny and her team are on a mission to change that. Through their research and entrepreneurial drive, they developed a unique probiotic product that's showing incredible promise in supporting gut health, and unlike other probiotics, during ABS flare-ups themselves.
Jenny's personal journey from academic to founder is fascinating, and she's going to share the vision, challenges and victories of building Ferryx from the ground up. So let's dive straight in and hear her inspiring story.
It's a pleasure to be here, both Peter and Mark. Thank you.
So Jenny, can you share a little bit about your personal journey that led you co-founding Ferryx, and what inspired you to take up this entrepreneurial path, kind of beyond your academic career, where it all started, I think?
I've spent most of my career working in academia at the University of Bristol, where I did a PhD in gut immunology and postdocs in the same field. So mostly looking at gut inflammation. So my background has all been looking at inflammatory pathways within the gut and how they occur and what we can do to disrupt them. But at the same time, I'm one of those 1 in 5 people who's affected by IBS. And it did have a huge impact on my lifestyle. So looking at my work life, simple things like going to conferences or team meals out could cause huge anxiety because my diet was quite restricted. So trying to find something that I could eat that wouldn't cause a flare-up was quite difficult. So a lot of the time I'd just avoid social situations so I didn't have to deal with it. But in 2009, in a university corridor, there was a chance conversation between myself and Dr. Tristan Kurgan, a colleague of mine and now co-founder of Ferryx. Tristan is a microbiologist. He's got a particular interest in the gut microbiome and the interactions between bacteria that are in that microbiome. And we got chatting about how come probiotics are so popular when there's actually very little scientific evidence for their efficacy in treating active inflammation. Probiotics are really good at keeping well people well, but when someone has an inflamed gut or they're really stressed, they don't work. So when people need help the most, these products are failing them. Now, as scientists, we found this really interesting. And of course, we wanted to see if there was something that we could do about it. So we came up with this hypothesis that it's all down to iron and the ability of probiotic bacteria to survive or not to survive in a high iron environment. So with that in mind, we developed a blueprint for a new probiotic and set about searching for it. We got no funding for this, just a huge amount of curiosity. So Ferryx actually started as an unfunded side hustle. It was just something that we were both really curious about and really interested in. But then fast forward 10 years, and we'd actually discovered something that worked. We set up Ferryx to commercialise this research, and we launched our first product, which is called Ferrocalm, just over 2 years ago. So Ferrocalm is a next-generation probiotic targeted towards people who have IBS, and unlike the conventional probiotics, this is something that can really work when someone has a flare-up or when they're stressed.
You mentioned that you've been unwell, you had IBS for a long time. Had you tried other probiotics and just found that it wasn't really hitting the mark?
Yeah, I tried all sorts of things. And again, found that if I was well, then they certainly didn't do any harm. But when things were bad, nothing was really helping.
So just for the benefit of our listeners to this episode, Jenny, can you kind of give us the kind of lowdown in terms of what makes your product Ferrocalm, as you mentioned, different scientifically, this iron pathway discovery that you mentioned, because that sounds quite remarkable in terms of how that works.
Yeah, so we think of iron as being something which is really good for us, which of course it is. We all need iron in our diet, but free iron can be pretty toxic, so our body keeps it locked away. In the gut, iron is absorbed and then it's taken into the blood and off to storage. But if you've got inflammation or you're stressed, this can go a bit awry. So stress hormones can stop iron from being absorbed from the gut. So it stops it from being transported out. So it starts to build up within the gut. If you've got active inflammation and you've got any bleeding going on there, then blood containing iron will also spill into the gut, increasing the levels of iron there. Now, the vast majority of bacteria that are present within our guts do very well with that iron. They can use that as a nutrient. They all start to grow and rapidly divide. But the bacteria that are conventionally used as probiotics, things like lactobacilli and bifidobacteria, are actually really unusual bacteria in that they can't use iron as a nutrient. They just ignore it. It doesn't do anything for them. So in that environment, these, the so-called bad bacteria do very well and the good bacteria do very poorly. They're crowded out, so they can't work if they can't establish themselves in that environment. So what we've done is we've identified a rather unique strain of bacteria. It's a strain of Streptococcus thermophilus called FX856. And this can use iron. So in an iron-rich environment, this will start to multiply and divide, so it can keep up with everything else, and it has anti-inflammatory properties. So when you're stressed and your gut's inflamed and you've got lots of iron in there, Ferrocalm can survive where other probiotics can't.
How interesting. I'm a GP. I prescribe loads of iron supplements, and I'm just wondering, is that one of the reasons why people get gut upsets with iron supplements, because it disrupts the gut flora?
Absolutely.
Okay.
Yeah. It causes changes in the gut microbiome, which then can impact on gut function.
You mentioned the Ferryx was founded as a kind of unfunded side hustle. So just tell us about the early days and what motivated you to keep pursuing this idea, even without any dedicated funding, which must have been pretty hard.
Yeah, absolutely. So this is something, say Tristan and I were were really interested in. We thought there's got to be something that we can do about this. So we started off by identifying what sort of species of bacteria might have beneficial properties, and then screening hundreds of different bacteria, looking for those which could use iron as a growth factor. As we took these candidate strains through more and more tests, there was a clear front runner, and that was FX856, which is now in Ferrocom. And as we took it through more tests, looking at things like inflammatory responses, impact on the cells that line our gut, and then things like safety as well. Obviously, that's a key point. We don't want to introduce anything into the body which isn't going to be safe or carries antimicrobial resistance genes and things like that. As we took this strain through all these rational tests, it came out as this clear front runner, and it worked. And we thought, okay, we might be really onto something here. This is really working. The results that we got were astounding.
Was it like a kind of amazing, exciting champagne moment when you look at the results from the test and it's like, yes. It works?
I still remember we had some external work done, and the report came back, and I rang Tristan. And I can't repeat what I said to him in a public forum, but something along the lines of, gosh, this really works. So, yeah, that was that moment we thought, yeah, this is something that could work in a real world situation.
What an exciting moment that must have been.
So that being a pivotal moment, obviously.
Yes.
What was the other pivotal moment, do you think, or turning point where you dedicated your time and decided to fully commit to Ferryx as a company and depart from your well, I don't know if you ever really truly depart from your academic career, do you? But
No.
Depart from your main academic career and then driving that forward. How did you balance the risks and rewards of that decision, Jenny?
So in late 2018, 2019, I was offered a place on the iCure program. So iCure is Innovation to Commercialization of University Research. So that bought out 3 months of my time to really explore the market opportunity for FX856 and what's now Ferrocom. The challenge during this time was to have 100 conversations with potential customers or stakeholders to see if it's something that's worth pursuing. So I spoke to people with IBS, people with IBD, inflammatory bowel disease. I spoke to GPs, gastroenterologists. I spoke to potential manufacturers, regulatory consultants, anyone basically who might have an opinion on what we were doing. The response to that was fantastic, and it really showed us that there's a market opportunity for Ferrocom. Speaking to people with gut health conditions was a real turning point for me. So hearing about how people have spent an extraordinary amount of money on products that just don't work, it felt criminal. I gave a presentation to a patient group at one point. At the end, invited any questions. And the first question was, where can I get this? I want to try it. And I could see that there was a real need in the market for something different. People were fed up of trying the same old probiotics. So setting up Ferryx was a risk. So it wasn't a decision I took lightly, but I think going through the iCure program and collecting all that data and evidence really helped me to make that decision. I had a great support system around me, and ultimately I decided that I'd regret not trying it more than I would regret trying it and failing. So I thought, let's just give it a go.
Give it a go. And did you give it a go yourself? Were you the first person to try it, or did you try it on somebody else first?
Yeah, we were making yogurt out of it for a long time before we developed the formulation that we have now.
Oh, fantastic. So we talked about that really exciting moment earlier on when the experiment came through and you got a clear front runner.
Yeah.
So that was perhaps one of the best times. Has there been a scary moment in this journey of academia to entrepreneur, running a business? Tell me about a scary moment.
So I think probably the scariest moment was when we incorporated in September 2019. So shortly after we completed iCure, we decided that's what we were going to do. We set up as a University of Bristol spin-out company. All was looking good. By the time we'd incorporated, we already had heads of terms for a licensing agreement for FX856 in our hands, and that was going to bootstrap the company. We were good to go. We'd based all of our financial projections on that. We were off and running. It was fantastic. And in the final stages of that deal, it fell through. we had no funding. We had to completely change our plans and our strategy. So we called on the ecosystem around Bristol for support as we realised quite quickly that we'd need to raise investment and didn't have a clue what we were doing with that. We got some really, really good support in helping us to put together a pitch deck and a strategy. We got some investor introductions. We thought, okay, this is good. We're starting to gain some traction. But then you know what's coming. March 2020. The world shut down. The world shut down. I had a pitch lined up with a group of investors who were really quite interested on the 25th of March, the week we went into lockdown. At that point, everyone just went underground because nobody knew what was happening. So the investors stopped investing because nobody knew what the future...
Everything stopped, didn't it?
Everything. So our plan A had gone, then our plan B was taken away from us, and suddenly we're having to start again, but in lockdown. But we still persisted because we had belief in the product, and we were fortunate that then through the iCure network, I was invited to speak at a KTN webinar about what we're doing at Ferryx. So presenting from my spare room at home, I think my son was under the desk as well, just for that authentic lockdown experience. I gave a presentation about the science behind our product and, what we're going to do. That single presentation led to us completing on another deal.
That's fantastic.
Which did bootstrap the company, allowed us to start manufacturing and really get going.
Wow.
Plan C came through.
Plan C
But also
came through.
just in the face of adversity, in terms of everything being thrown at you. Well done.
Yeah.
I mean, that is fantastic.
Thank you. We were very fortunate, I think, with the network that we had around us.
So Ferryx is a university spin-out company, isn't it, Jenny?
Yes.
How have you maintained those important ties to academia, and how do you see the ongoing collaboration between Ferryx and universities benefiting your work and any future plans as well?
Yeah, so I think you said earlier about how you never truly escape from academia, do you? And coming from an academic background, I see huge value in universities and the contribution that they can make to many different aspects of what we do. Our co-founder, Tristan Cogan, is still a full-time lecturer at the University of Bristol, so we still have strong ties to academia. And this has been really valuable to us. I mean, our universities are a wealth of knowledge, expertise, and facilities, which can provide great resources for us on a variety of different topics. I've already talked about the help that we had with research commercialisation, and this still continues. But we do a lot more than that. So universities are obvious partners for scientific research. We've recently had some Innovate funding to be able to work with Ulster University to conduct our first placebo-controlled trial of Ferrocalm in people with gut inflammation. We're going to be working with the team at Ulster's Nutritional Innovation Centre, who are very experienced in nutritional trials and have world-class facilities there. It's a fantastic resource for us, which we're able to work with them on. Universities are also a great source of student talent, and we've offered student projects in a variety of different topics. We've taken on interns to help with marketing, for example. So actually, our very first e-commerce website was built and launched by an intern.
Brilliant.
So it's a fantastic resource. And we've recently completed a couple of projects working with data science students who've been helping us to analyse our sales data, understand our customer purchasing habits. So that information's really important as we get to know our customers better and we can give our customers what they need. So working with students has been really beneficial for us. It's been beneficial for our business critical activities, but it's also allowed us to undertake those curiosity projects. And I think those are sometimes the ones that can be really, really fruitful. So these are things that, they're not business critical, but they could open new markets in the future. So it's a great way for us to explore new applications by having an enthusiastic and excited student coming in and working for a few months on a project to generate some early data.
So what keeps on driving you and your team to keep pushing through? Because there are going to be ups and downs with running any business. So what is it that keeps you really going?
So IBS can put a huge amount of restrictions on people, as we said earlier. So including it affects things that they eat, their work, their social lives. We want to lift some of those restrictions, take away some of those fears so that people can enjoy life in the way that they want to. So, for example, one of my favourite testimonials was from someone who can now eat BLT sandwiches again.
Absolutely crucial.
Exactly. So it's something that had previously been off limits for him. He said he tried one, no ill effects. So we had another one, and it was fantastic.
It's a miracle.
And it's those little joys, those small bits of joy in life that really bring colour and enjoyment to what we do. And for us as a company, it's huge to know that we've impacted someone and just brought some joy into their lives. That's absolutely fantastic.
Well, it's not too dissimilar to previous podcast episodes, Peter, where we've talked about the isolation from not being able to eat certain food types or not being able to go out for social engagements. And if you're disabled in some way because of the gut inflammation within your system and how that plays out, it can be quite isolating actually for you, or it can be removed from society.
And Jenny mentioned that at the very beginning, didn't she?
Absolutely.
You said how you kind of sort of dread some meal times and social engagements because of the impact that it might have on you and your food choice.
That can have an mental health impact as well, I would imagine as well. So it's an interesting point actually as well. Yeah, absolutely. You've mentioned the challenges of marketing and reaching the right audience, Jenny. Can you share some of the creative strategies you've explored to get the word out and about there, about Ferryx, and how you connect with your target customers?
Absolutely. So we use social media for the vast majority of our marketing. It's a great platform for getting the word out there. It also allows for very quick two-way communication. People can ask us a question, they can leave a comment on a post and we'll reply to that. So it's a really good way of engaging with our audience. We have found humour to be one of the best ways to connect with our audience. So there's often not much to laugh about with IBS, but our creative team are fantastic at creating posts that really resonate with our audience. So, for example, we had a post go viral on TikTok about those toilet roll dispensers that you find in public toilets where you can just pull a single sheet out of the centre of them. So we did a video of that with a headline over it saying, "Whoever invented these didn't suffer from IBS."
Brilliant.
And we had so many comments on there with people sharing their hacks for pulling out multiple sheets all at once. Apparently it's all in the speed that you go at and things like that. So it's absolutely brilliant. So sort of those funny, relatable posts are our bread and butter. But we also rely really heavily on testimonials from real people. So like the guy who can eat his BLT sandwich, we'll share that because it's those relatable things. Someone can recognise that, that's the position that they're in. And that if this is something that's helped somebody else, maybe it could help them too. And finally, with much encouragement, I've started to open up about my story. So this is something that I was quite reluctant to do. Like many people, it's quite uncomfortable talking about these things. But this is why people put up with things and they suffer in silence and they don't find new solutions. It's because people aren't talking about them. So by sharing my story, it shares the reality of the situation, and it's why I'm so passionate about Ferrocalm as well. I'm not just the scientist behind Ferrocalm, I'm somebody who's personally benefited from the product, and so that's what makes me so passionate about it.
Oh, that's so good to hear. Jenny, looking back on your journey so far, what has surprised you the most, whether positive surprise or negative surprise?
So the biggest surprise for me, coming from a scientific academic background, is that no one cares about the science. Once you have a product, I know. Once you have a product that you know works, if you've got an academic background, people just believe you. I always wanted to talk about the nitty-gritty of the science and why this is really cool and why this is so different. But generally, that just makes a lot of people switch off. In the commercial world, things are viewed very differently to how they are in science. People want to know that you have a solution to a problem, how you're going to get that solution to the people who need it, and how much money you're going to make from it. That decade of research that went into solving the problem now takes a back seat. So that was quite surprising, learning to talk in a different way about what we do. But another surprise that I had, a more positive surprise, is how willing people are to help. The startup ecosystem around the Bristol area is absolutely fantastic, and so are the support services. So we've got places like Future Space attached to UWE, we've got Set Squared and Science Creates, who all run workshops, one-to-one advice sessions, and lots of networking events. I've learned so much about how to run a business from these organisations because I was completely naive to the world of business when Ferryx started. But by surrounding ourselves with the right people and asking for help, we've been able to launch a product on the market and start to generate revenue and help hundreds of people already.
Oh, that's great. And I can reassure you, Jenny, I'm interested in the science, even if nobody else is. So
Thank you.
I can have my own private tutorial. And for fellow academics, if you still consider yourself to be an academic, but for academics listening who might have a breakthrough idea brewing in their mind or in the laboratory, what might be the first step, proper concrete steps that you might advise them to take?
Sure. So the first thing I would say is if you think you've got something that you might want to commercialise in the future, speak to your tech transfer team. For us, our tech transfer team were absolutely instrumental in getting Ferryx off the ground. Right from the early days of, I think we might have got something, through to where we are now. They've guided us through that whole process of research commercialisation. They're incredibly supportive, really knowledgeable, and have held our hands from day one. So absolutely go and speak to your tech transfer team. Secondly, don't talk to anybody else until you've established your IP position. If you want to file a patent, you might compromise that by talking about your data at conferences or publishing papers beforehand. And as an academic, of course, you want to go to conferences, you want to talk to everybody about what you're doing. But actually, if there's potentially IP there, you should keep that to yourself for a little while until that's been sorted out. And finally, I think it's about finding your support networks. Again, that's been vital for our success, whether that's those support services, whether that's like your peer network. My peer network is incredible. There's always somebody willing to have coffee and talk through a problem or share some ideas. And finding your people makes a huge difference.
3 really helpful bits of advice for any academics out there
Absolutely, yeah.
who potentially have a brilliant idea that could change people's lives. So Jenny, time has flown by as always. Thank you so much for sharing your journey from academic to entrepreneur.
Thank you very much for having me here.
Imagine if something as simple as putting on your socks in the morning could revolutionise how we monitor and improve our health. Our next guest, Dr Zeke Steer, founder of Milbotix, has developed smart sock technology that's turning this everyday garment into a powerful health monitoring tool. From tracking gait patterns to detecting early signs of anxiety, these aren't just socks. These are potentially life-changing devices that could transform how we approach preventive healthcare, rehab and ageing.
Zeke's journey from concept to commercial reality showcases exactly the kind of innovative thinking that's emerging from health tech incubators like Future Space. And his story demonstrates how breakthrough technology can hide in the most unexpected places, including your socks. Zeke, welcome to the podcast. It's fantastic to have you with us today.
It's good to be here, and I'm very grateful for this opportunity to talk a bit about smart socks.
Great. So tell us all about smart socks. What are they and what do they do?
So Smart Socks is a smart garment. It's been developed with funding and support from Alzheimer's Society. And it's primarily targeted at people with dementia, although we recognise that people with other neurological disorders might benefit from use of the product. And I think to explain the benefit of Smart Socks, it helps to talk a bit about some of the challenges that dementia carers face and people with dementia face. So commonly, dementia is associated with short-term memory loss, leading to increasing difficulty recalling names and faces, leading to disorientation. For example, many people with dementia get lost when they're out and about in familiar places. Cognitive decline, increasing dependency on family and eventually on professional carers. However, there is a dark side to dementia, which isn't really spoken about so much. And this is with behavioural and psychological symptoms of dementia. So these symptoms affect about half of people with a diagnosis. They're especially prevalent in some subtypes of dementia, like Pick's disease, which is a form of frontal temporal dementia and causes disinhibition. So people can become quite challenging to deal with, quite sexualized. Oftentimes, these symptoms lead to increasing irritation, agitation, aggression that's uncharacteristic for the person, increased motor activity. You often see pacing behaviors, particularly around sundowning times. You see increased wandering. You also see neuropsychiatric symptoms, so hallucinations, including something called parent fixation, where many people will believe that their parents are with them and they will have conversations with them, even though those people passed away a long time ago. So you can understand that these symptoms are incredibly burdensome for caregivers. I think it's one thing to attend to somebody's physical needs, but actually when you see the person that you love and you know very well transforming into a different person, somebody who can be quite hostile and unpredictable, that's incredibly tough as a loved one of that person to cope with. And so what we find is that many people with these symptoms are placed in care homes. However, the care homes aren't always the best place for them to be. I think most importantly, though, many people with dementia prefer to continue living at home, where they're more comfortable, where they're surrounded by familiarity, access to loved ones. Giving up their independence is difficult, something that maybe they don't want to do. They don't want to lose their sense of purpose, their autonomy, their ability to do the things that they love to do. So really, Smart Socks was conceived as a way of addressing these problems head on. We are providing a comfortable wearable device with embedded textile sensors that measure physiological precursors of a behavioral escalation through things like pulse, temperature, and sweat. And we use artificial intelligence to classify that data in order to understand when somebody is on the verge of having a meltdown. We alert the carer via a smartphone app, and this gives them an opportunity to alleviate distress, to calm and reassure that person before behavior escalates. Our hope is that through using Smart Socks, people with dementia can continue living at home for longer, if they choose to, and that when they're admitted into a care home, the care team can be more responsive to their needs, can identify when they're in pain, when they're anxious, and hopefully provide appropriate support in a timely manner. In addition, we've seen, so this is not in relation to distress necessarily, but we've seen through our conversations with health and social care organisations that there's a lot of interest in using Smart Socks as a means of assessing and monitoring mobility. So in the UK, about a third of over 65s fall every year. Believe it or not, 80% of people with dementia fall as well. And that's often due to this increased motor activity that I spoke about, but also increasing frailty as people age. So with Smart Socks, we are analysing gait to identify changes in parameters like walking speed, stride variability, and activity levels so that we can start to understand when the person might be at an increased risk of falling. We can provide this information to a caregiver who can implement an appropriate intervention to prevent that fall taking place. So in summary, Smart Socks is a distress early warning system intended for use within the person's own home, but also within a long-term care facility. And it's a solution for fall prevention.
It's just amazing in terms of the journey there, Zeke, as you've outlined it as well. We often find, though, don't we, that with founders of companies or products, they often have a personal experience that leads them into developing a product. And you've mentioned the population base here in terms of where this technology could be most useful. What's your story behind founding Milbotix, and how did you end up working in this fascinating area of wearable health technology?
So my own background actually is as an engineer working in the defence sector. And I worked in defence for about 10 years, initially in an area called force protection. I then moved into artificial intelligence, and I was working with a cross-disciplinary team to identify emerging threats in social media. It was a really exciting project, and my first exposure to AI, actually. But around this time, my great-grandmother was diagnosed with dementia. Her behaviour started to change. She became increasingly agitated, increasingly aggressive. She desperately wanted to continue living at home, but my family were really struggling to cope with her behaviour. And one Christmas it reached a crisis. She became physically aggressive towards my grandmother. And at that point, the decision was made, she has to move into a home. So she moved into the home. She really struggled to adapt. She became even more agitated. She tried to escape on several occasions, and one time she was successful. She made it out of the home, but she was recovered. She withdrew into her own space. She didn't have any engagement with other residents in the home. And it was a really tough time, seeing this lady who had been so fierce, so proud, deprived of her independence and her dignity in the later stages. So I decided I wanted to apply that technological skill set that I developed through my defence career to help the growing number of people like her. That led to PhD research at the Bristol Robotics Laboratory, based on the UWE campus, so I've been kicking around these parts for a fair few years. That project explored two different strands. So the first strand was more of a quantitative research piece, seeing if I could detect signs of stress through a wearable device, through the physiological data that you can collect. And I was taking healthy older participants through a range of different experimental scenarios, eliciting pain, social anxiety, cognitive load, and analysing the data from the wearables statistically to see were there any changes there that could discriminate stress from relaxation. And I did find that there were about 5 key parameters that were useful. The second part of the research was much more qualitative. I was fortunate to be working with St Monica Trust in Bristol, and I ran a series of focus groups with care teams there, taking in different wearable devices to understand why wearables aren't more widely adopted within the care sector. And these devices were worn on the wrist, they were attached to the hip, various locations. Unanimously, the feedback was very negative. I was told people with dementia won't wear this device, they'll become quite irritated by it, they'll fidget with it, they'll remove it. Anecdotes were relayed to me about how people had taken devices off, they'd flushed them down the toilet, they'd put them in the bin, the carers were finding them all over the place. So it became clear quite quickly that a wrist-worn device or a more conventional wearable form factor just wouldn't work. And that led me to thinking about more novel ways of collecting that data in conjunction with the care team. And ultimately, we settled on the idea of using socks as something that's familiar, comfortable for the person, habituated, and out of sight, out of mind, so unlikely to be removed.
Goodness me, like many of our listeners, I've got personal experience of dementia in my family. Just hearing you talk brings it all back. And yeah, I love your transition from the defence industry into something like this based on your personal experience. Very moving. Looking ahead, could you paint us a picture of how your smart socks technology could really transform people's lives? You've given us a hint of potentially what it could do, but a bit more detail.
Definitely, yeah. So our starting point actually is in research. We've just launched our first product, which is called Smart Socks Discovery, and that is very much a research data solution. We're targeting primarily research into brain health and associated lifestyle factors such as sleep, exercise, diet. The idea is that using socks, you can collect this data on the person's physiology, their activity levels, their gait, in very naturalistic settings, in a way that doesn't impose on the person. It's inobtrusive. We're not going to be changing behavior, which is often a problem when you collect data with devices that require, some interaction with them to function. We're really excited about this product. We have quite a few sales already, so it's flying off the shelves, which is wonderful. We are talking with universities internationally as well. We're looking at how we can get this outside of the UK, and we've already supplied kits into Finland and the Netherlands as well. So that's our starting point. Really, it's a way for us to establish our credibility in the space, to refine the product with experts before we go into social care with the next product. And this is still in development. This product is called Smart Socks Comfort. As I described earlier, it's primarily a system for providing an early warning of distress to reduce escalations in behaviour, and for understanding the trajectory of a person's mobility in order to prevent falls. We're going to be announcing this product at the Care Show in early October, and we're seeking co-development partners as a means of really providing a test bed for this technology. So in the early days, we can understand what some of the challenges might be before we roll it out on a larger scale. We do already have one co-development partner, an organisation called Cornerstone Healthcare Group, who are based in the south of England. And we're looking to grow that base of partners so that we deliver a product to market that really works. The vision for us actually is in healthcare, primarily for people living in the community, with a tool that can collect vital signs data on stress, and behavioural and activity data on virtual wards. So you'll be aware that the Labour government now is focusing on delivering care in the community, close to people. There's a big push for prevention over reaction to treatment. And we think Smart Socks offers a real opportunity here. So frailty virtual wards are not really working very well. The NHS are pushing technology enablement, but people with frailty often have low self-efficacy with technology. They have sensory and cognitive impairments. It makes it very difficult for them to use technology devices. And there simply isn't the resource within the NHS to make these virtual wards work without technology. So they're crying out for a solution that is going to take away a lot of the complexity for the end user. And we think with Smart Socks, it's as simple as the person putting on their socks in the morning, going about their daily routine. All the while that data is collected, it can be made available to a clinician. It may be in primary care, escalated through to secondary or tertiary care if needed, and ultimately providing early detection of abnormalities, the ability to triage that and ensure that people receive care in a much more responsive manner.
Fascinating. And I was just wondering, you mentioned earlier on about one of the challenges that we face with people with dementia is sometimes they wander and get lost. Is it possible potentially to put some sort of tracking device in the sock as well? Because it can just give people a little bit of reassurance that if their loved one isn't where they thought they were, they can quickly find out where they are. Do you think that might be a possibility in the future?
It's a really good idea, and actually you'd be surprised at how many times that feature has been requested. So it's certainly on the roadmap.
Right.
We do have a project ongoing at the moment to develop the next hardware platform, the next generation socks. And actually, as part of that project, we will be introducing GPS. So it's coming.
Fantastic.
You've already mentioned some exciting partnerships that you've got underway, but what else can you tell us, particularly with UWE and the Bristol Robotics Laboratory? Can you sort of share, well, what you can that's not commercially sensitive anyway, sort of kinds of research and exciting partnerships your product is enabling right now? Is there anything you can share with us?
Absolutely, yeah. So we've placed actually 4 Smart Socks kits with UWE. We have a project with Professor Carlos Cifuentes, who is developing a smart walker, which is a walking frame with embedded intelligence that can help the user navigate around the environment, detect risks like fall, trip hazards. It can provide physiological sensing and analyze how they're mobilizing as well. So we're going to be introducing Smart Socks into that project. It's a collaboration with Extra Care, who are just across the road from UWE. So, really exciting to be working with the care organisation as well. In a similar vein, we have a project with Dr Jack Fennell. So she actually is a co-founder of a dementia innovation company, also funded by Alzheimer's Society, called Hug by Laugh. And she has developed this product called Hug. It's a therapeutic comforter. It looks a little bit like a teddy bear, but it has weighted and very long arms that can wrap around you and give you the sense that you're being hugged. It has a beating heart that provides a lot of comfort as you hold it close. And it has a music player, so very useful for reminiscence therapy, music therapy, as a means of calming people with dementia down. So they've got a strong body of evidence that this can help alleviate distress. It can improve outcomes for people with dementia. But at the moment, it is purely an output device. There's no sensory input into it, so it can't be used in a responsive way. And I think the idea with the integration with Smart Socks is that we can identify when the optimal window might be for that intervention to be used.
So that kind of cross collaboration with other innovators in terms of with their products is really key then in terms of where your products could really kind of link through their.
I think that's a huge opportunity, yeah. And we're hearing from lots of care organisations that they don't want point solutions anymore. No. They want solutions that integrate, that talk to each other, avoid data silos, provide a big picture view on what's going on. That's where we're going.
What are you learning from all this as an entrepreneur yourself? What are you learning from this kind of interaction with others and ways of working? What are you learning about this?
I think it's, especially as a hardware innovator, it's incredibly difficult. The capital requirements are very high compared to, say, a software solution. There isn't a lot of investment kicking around at the moment, so it's very difficult to raise the capital that you need. But at the same time, it's a product that's so tangible and people can really grasp it. And we're getting such positive feedback that it's motivating. It makes all the challenges that we face worthwhile. And we know that if we plug at this, we're going to really hit on a gold mine. Not just financially, but in terms of the impact that we can deliver.
Yes, absolutely.
And we could see that's your original motive in the first place, to help people's lives so they don't have to go through what you and your family have had to witness yourselves. So
Exactly.
you mentioned your research product, and also you've told us quite a few suggestions on that roadmap of yours of things that you are in the process of developing, will develop. Looking even beyond that, and this kind of sense of technology, wearables in particular, do you think there are any game-changing technologies around the corner that could really shift things, kind of a paradigm shift or anything of that sort that excites you?
I think it's much more about the integration piece and then the analytics that can be used to provide insights on the back of that data. So there's a lot of hype around AI at the moment. I don't think we've really scratched the surface of the possibilities within the healthcare space, no. And it's all about bringing that data together, making sense of it, and then using that to understand, to predict, and support the delivery of care.
Yeah, so better use of data.
Absolutely.
I think so.
And as part of your journey, you've been involved, obviously, with Future Space. We had Matt Freeman on earlier in this particular episode. How did that experience, and how does that experience contribute to where Milbotix is today, Zeke? And what would you say to other health tech entrepreneurs who might be considering similar kind of accelerator and incubation programs? Any advice you give to them?
I think Future Space is a really good place to base yourself if you're a health tech innovator. Firstly, Bristol has a very strong health tech ecosystem. I think plans are afoot to build a health tech cluster, which has been spearheaded by Set Squared, or at least was being. And I know Future Space are involved in that. They've hosted organisations like OBN, which are very much within that remit, that field. We've had a lot of support from Future Space through collaborations with the Health Tech Hub, with academics directly, including Dr. Jack Fennell, Carlos Cifuentes. It's been a really good place for us to be. The internships are nice, so you can get access to free internships, free interns. And we have a huge amount of work to get through, so that's very, very helpful. Generally, just a nice community feel, and everybody is eager to help each other succeed. There's no competition between companies. We're all synergistic, and we're all doing our best to support each other and add to that ecosystem that's forming here.
That's great to hear. That's really, really positive.
And for our listeners, whether they're researchers, potential collaborators, or hopefully even investors, what would you like them to know about working with Milbotix? What are the opportunities you're really particularly excited about that potential people could work on with you?
Yes, I think I mentioned that we're looking for co-development partners at the moment. We have one already in place, but we're going to be going on a drive to start to build those links.
So is this kind of care providers, care homes, those sorts of things?
Exactly right, yeah. Places where we can deploy smart socks at an early stage, in a testbed type environment, start to collect data, start to collect feedback from carers, from residents, and understand how we need to evolve the product. All of our work at the moment has been done within residential care. We would love to branch out into dom care as well. So that would be really exciting.
Right.
I think in a similar vein, we're looking for partners to distribute the product. We know that integration is really, really key with third-party software systems, so we'd like to have those conversations early to understand how we can work with a distributor to build the adoption of the product, rather than developing the product and then going to somebody and saying, look, can you sell this? I think actually we need to really understand what it makes to support this product in the field, to train people in the use of it, and ensure that we're ticking all those boxes very early on in the development. We're raising investment as well, so we're halfway through our £500,000 investment raise, looking to close that by the end of the year. And we would love to have conversations with investors and bring more money into the business so that we can accelerate our journey.
Well, you've certainly got plenty of things in the pipeline
Absolutely,
that,
yeah.
from what I've heard, would really benefit from some investment. It's going to make a big difference to people's lives. And the market size, it's got to be pretty big, surely.
Huge.
Sadly,
Sadly.
the market size is very big and probably growing, isn't it? So could be a good opportunity for an investor.
So Zeke, this has been an absolutely fascinating, and for you obviously a personal journey as well. And I've just loved how you've come across today in terms of your origins in defence and what you've learned from that field, then into AI, then into something which was obviously personally impactful for you and your family in terms of wanting to make a big difference within society. So thank you so much for today. From smart socks that could revolutionise how we monitor health, to know when to come in with the right interventions, as you say, in terms of support for patients with dementia, etc., to the exciting research partnerships that you're building and have built as well. It's clear that Milbotix is at the forefront of wearable technology for healthcare. And for listeners who may want to learn more about your work, where would be the best place to actually find it? Is there like a website or some kind of information space where they can get that?
Yes, so our website is www.milbotix.com, Milbotix with an X at the end. You can contact us there. You can also contact me on my personal email address, Zeke@milbotix.com. I'd love to hear from you, especially if it aligns with the opportunities that were presented here.
And what we'll do is we will put a link to the website in the descriptor for today's podcast episode as well, so that listeners have got that as well, okay? But listen, seriously, thank you so much for joining us today, Zeke. It's been a real pleasure hearing about your journey. Keep going, because I think entrepreneurs, do amazing work, and they're quite some hard, challenging times sometimes. So keep going, and wish you all the best of luck for the future as well, and the incredible potential of this new technology as well. So fantastic. We'll be watching with great interest.
Appreciate that very much.
Yeah, I absolutely loved hearing your story, Zeke. So important, such a big area, so much need. And I just loved the values that you bring to it, as well as your expertise, your technical expertise, and now business expertise. It's just really inspirational. To our listeners, if you're as inspired as we are, please do consider subscribing to Let's Talk Health and Care on your favourite platform for more stories of health innovation.
Until then, it's goodbye from me, Mark Griffiths.
And from me, Peter Brindle. Stay healthy and take care.